Well, Israel's vaccination program has been one of the most successful in the world, with more than half of its population inoculated. The country's now reopened schools and people no longer have to wear masks when outdoors. But the situation in the occupied Palestinian territories paints a very different picture. On Tuesday, there were 376 new cases reported in the occupied West Bank and 1,038 in Gaza. Israel reported just 83. And as Israel surged ahead with its vaccination program, the Palestinian territories lagged far behind. The West Bank has vaccinated just 216,000 of its 2.7 million population, with Gaza just 36,000 of its 2.2 million people. Now, Gaza is one of the most densely populated areas in the world, making vaccinations even more imperative to control the virus spread. So far, only 110,000 doses have reached the blockaded territory, enough to fully inoculate just 2.5% of those who live there. The United Nations says that it's Israel's responsibility under international law to provide equitable access to COVID vaccines for Palestinians living in the occupied territories. But Israel's health minister says Palestinians must take care of themselves. Well, Nizar Sadawi will give us an update on vaccinations in Gaza shortly. But first, let's bring in Mustafa Fatih Yavuz, who's joining us from West Jerusalem. Mustafa, good to have you with us. Now, Israel's leading the world with its vaccination program, but they've almost reached herd immunity. What's it like now in that part of the world? I can see you're not wearing a mask.
Kamal, right now I'm in a place called First Station. This place is one of the cultural centers of West Jerusalem. I can see some restaurants and coffee shops and cultural attraction centers still open, and people almost went back to normal. The only thing that reminds us that there is still COVID-19 in the country is that some people still wearing masks, but they do not have to. It's not a must for them, because we know that 2 weeks ago Israeli government lifted mask wearing mandate outdoors, but they still have to wear masks indoor gatherings, and Israeli health ministry recommended those people to wear masks outdoor gatherings also. It was only a recommendation, it's not a must for those people. It looks like so far Israelis almost went back to normal. When we look at the official numbers, if official numbers tells the truth, Israelis, almost 56% of Israelis vaccinated, which means that it's around 6 million people, and we are talking about 9 million people only. That's why Israelis are talking about whether they reach herd immunity or not. When we look at this, what's the reasons behind this success, that we can say around 9 million population only, we are talking about relatively less number of population. And it's the other thing that reportedly Benjamin Netanyahu's good relationship with Pfizer's CEO that allowed him to bring more vaccinations to Israel. And the other thing that I think Israelis have some economic resilience because of these closures. They suffered a lot, but they are still alive, so to say. And Israeli economy almost went back to normal. When we look at the unemployment rate, that was jumped from less than 4% to more than 21%. Now it went and it decreased again, less than 10%. Now it means that economically it's also Israel is going back to normal, but it doesn't mean that it is completely normal right now. Israel still taking precautions. We still do not see any tourists in the country. Israelis do not allow any tourists to come inside the country because they are mostly afraid of new variants. According to Israeli officials, new variants can break through Pfizer vaccine, especially Indian variant, because they were saying that Indian variant have 13 different mutations that will be very deadly for Israel and for Israel's new normal. That's why they do not allow tourists to come inside. When we look at the reports, we were expecting to see tourists, especially those who are vaccinated in their home countries, to come inside the country starting from May 23. But according to latest reports, Health Ministry recommended Israeli government to postpone it to another month. If Israeli government approves this recommendation on Tuesday, we will see tourists who are vaccinated in their home countries to enter Israel starting from at the end of June.
Okay, Mustafa, thank you very much for that reporting. Let's go now to the Gaza Strip and speak to Nizar Sadawi, who's joining us live. Nizar, good to have you with us. So just describe for us, if you can, how people living in Gaza have dealt with this pandemic.
Well, yes, now it's been a year, almost a year since the pandemic reached the Gaza Strip. We know that there are more than 40,000 active cases. 878 people have lost their lives to the pandemic so far. A lot of measures have been taken by the local authorities here in Gaza. last week they imposed new restrictions of movement. They shut down everything. They impose a completely night closure every day during Ramadan, from the Maghrib prayer until the dawn prayer. But we know that there are a strong sense of fear among both health officials and residents here, especially with the scarcity of resources and medical supplies as the new variants are beginning to reach the Gaza Strip. They have no other means of dealing with this. We know that there is a certain shortage in oxygen generators in all the hospitals in the Gaza Strip. There are, as I said, more than 14,000 active cases now. The vaccines that entered Gaza Strip are not sufficient for everybody. They said, the health officials here are saying, if they wanted to vaccinate everybody, they would need 2.4 million doses. So far, people who have been vaccinated are a bit over 36,000 people. The shipments of vaccines, we can say that 110,000 doses entered, which is sufficient for only 55,000 people here in Gaza. We also know for sure that this isn't enough for anything. Health officials are telling us that there are more than 150,000 people who are among the most important target groups to be vaccinated. That includes obviously medical workers in the medical field, elderly, people with chronic diseases, and also people with problems with their immunity systems. So that you're talking here about 300,000 doses that Gaza desperately need at the moment. There have been other measures by the government here in Gaza. They're trying to impose people to or force people to adhere to preventive measures like wearing a mask. Violators are being punished. Sometimes they pay fine. They can even go to jail. Recently, I can tell you that one more significant decision was made yesterday by the crisis cell management in Gaza, which is to reactivate the mandatory quarantine for those citizens who enter the Gaza Strip through the crossings, whether Ares checkpoint or Rafah crossing board. You're talking about a 14 days quarantine, which was not mandatory. But we know that the situation does not bear any negligence from people or from the authorities here. Just in March alone, we know that the number of active cases here in Gaza tripled.
Nizar, it's quite a different picture that you paint to what's happening, and as we heard from Mustafa, in West Jerusalem. I do wonder what plan there is in place from the Palestinian Authority to increase the number of vaccinations.
Well, regarding the vaccination, as I said, only 110,000 doses entered so far. Now, the Palestinian Authority, specifically the Ministry of Health in Ramallah, are saying they already agreed to purchase 4 million doses of the Pfizer vaccine from the company. They're saying that it's not going to come soon, but it will be on different shipments. They also said that a few shipments of the Sputnik Russian vaccine will be arriving soon. Of course, we understand that there's also other shipments coming through COVAX organization, but we do know that there is a share for Gaza. Now, whether there will be any barriers or obstacles from the Israeli side, we don't know that for sure, but we know once the Palestinian Authority gets these vaccinations, a part of it will be directly transferred to the Gaza Strip, perhaps through the WHO office. In Gaza also, there's a strong sense of fear because of the new mutations, the new variants, specifically the Indian one. Yesterday, they said, the Ministry of Health in Gaza, that they sent more than 200 samples to the WHO office in Jerusalem to be tested if Gaza has the Indian variant or not yet.
Okay, Nizar Salawi in Gaza, thank you for that reporting.